So I'd like to welcome again Melinda Reeves, who spoke earlier for those of you that were here, and in regard to this whole area in regard to maternity and how to care for your newborn child when you come back home. Thanks, Melinda.
Thanks. Okay, not being as tall as mine. I have been asked to do this in about 10 minutes. Normally I'd cover this in 2 days or 2 hours, so it's going to be really, really quick. It's really hard to know what exactly you wanted in this session. It's about, they said, you know, care of baby, feeds, how to feed, sleeping times, you know, a whole range of things. And obviously we're not going to get that done in 10 minutes. But I'll just click through a few of them. But first of all, obviously you need to know what's going to be available to you wherever you're actually going to have the baby. So in Australia, you know, what's the policy of the hospitals? Are there going to be people there who can teach you and look after you? Are you going to have to travel? Is there one person travelling or two? How much information do you have about babies, and have you cared for babies before? And do you need to be educated about what a baby is and what the requirements are to look after a baby? Other things, obviously we talked earlier about being flexible in contingency plans, and that's important too. So looking at some practical and theoretical information, the key things I was going to discuss were what is a newborn baby, their behaviour immediately after birth, as well as practical parenting, you know, the guidelines around safe sleeping, newborn feeding, and also crying and settling, but we're obviously not going to get all that. I think one of the most important things as a new parent is to actually understand that babies are not mini adults. And that's the most important thing. Babies at the time of birth do not think, rationalise, make decisions, act according to, you know, different ideas and thought. Babies aren't capable of doing that. Babies are purely and simply a sensory being. They act entirely according to how they feel. So what they see, hear, smell, taste and touch will have an impact on their environment. And if they're all good things, they're happy, and if something's out of kilter, they're not. It also has a lot to do with, in a traditional pregnancy, the baby throughout that whole 8 to 9 months is associated purely and simply with mum for the large part of it. So that woman has a lot to do with that baby's sense of security immediately after birth. And given time, I'd go through some of the things that intended parents can do to make that baby feel potentially more secure at the time of birth or in those first few days after birth, to get some of that sensory feeling of safety afterwards. And those sorts of things might include providing your surrogate with a blanket to sleep with, you know, a baby blanket to sleep with prior to actually having the baby, so that that's still got mum's smell on it, because mum's smell is very closely associated to the amniotic fluid, which is the baby's floating in. If to have a piece of clothing that mum's been wearing, so whether you give her a sari or a t-shirt or a dress or something like that she can be wearing herself, and keeping those things, don't wash them, please don't wash them, but to use those, because it's got a lot of the stuff on it that the baby is actually already familiar with, and from a sensory perspective, that can make their transition from being in utero to birth a much more simpler and pleasant one for them. Hearing, the main things about that is obviously they're going to be listening to the woman who's talking to them throughout the pregnancy. So if they do talk in another language, you know, having a tape of, for example, an Indian conversation with mum to bring home with you. Alternatively, for you to have conversation, you know, just have it on playing at home, so that at some point you can go, right, I'm going to send this over to them, and she can actually play it once or twice a day if she's got the facilities to do that, so that your voices are actually familiar to the baby, because the hearing is their greatest sense at the time of birth. So if they already know you as a familiar person, then they will actually relate to you and transition to you way better. I've already mentioned about taste and smell and skin-to-skin touch. Other things about their behaviour immediately after birth, if you're in an Australian hospital, 99.9% of the time the baby would be handed directly to you. So first contact is always with the intended parent. If you're overseas, as we've already seen, baby's either in an operating theatre having a caesarean section. It can be handled by several people before the intended parents actually have the baby. And so therefore, you know, making that transition to you and holding them and stroking them. Babies at birth believe that they're ahead. I know that sounds really odd, but babies don't actually know they've got arms and legs in the body. So in order for them to feel safe and secure, cuddling and holding your baby is one of the most valuable things you can do to them. Stroking them while you're holding them is really important so that they do become aware that their arms and legs are actually part of their body. And this information, although we've known it for about 30 years, it's not something that's taught in a lot of antenatal classes in your average hospital either. So with the work I do, this is the sort of stuff I tell parents, and it makes a huge difference about their ability to relate to their baby and for the baby to actually relate to them, and it just makes everything so much easier. Babies at the time of birth aren't hungry. They've been used to having amniotic fluid in their gut and their stomach area. They do often have a small vomit at the time of birth, so there's a small amount of amniotic fluid left. But because the baby's always had a full gut, they're not actually hungry at birth. Their main reason for crying is because they've been in this really confined, safe, comfortable environment and kind of bungee jumped in this big wide world where they feel so insecure, arms and legs flailing. And by the time they actually settle with someone, most babies will have a feed within the first 1 to 2 hours. But because I'm making a huge presumption, but because most babies are not breastfed, they may be offered breast milk, but they're not actually breastfed, babies actually do feed slightly differently according to whether they have breast milk feeds or formula feeds. But they do become hungry within about 24 hours because there's a lot of physical things that are changing in their body as well. And that perfect baby you have on day 1 will actually be potentially a horror on day 2, 3, 4 and 5 until they become more settled with their feeding. To do with hunger as well, a baby's born with a stomach about the size of a marble. So we're not going to shove a whole lot of milk into it, and that will actually increase to about the size of a small egg by the time they're about 2 weeks of age. So because they have such tiny stomachs, they do feed really regularly, and that includes every 1 to 2 hours. So most babies feed very regularly in the initial period of time. Meconium is their bowel actions for the first day or 2, and because they're losing meconium and they lose something called brown fat and they've lost all the amniotic fluid, that's one of the main reasons why they become hungry after about 24 hours. With terms of practical parenting, nappy changing, bathing, dressing, burping, wrapping, all those types of things, you may get information from friends and family. Knowing whether those services are going to be provided to you. If you're in Australia and in a standard hospital, then the midwife will be teaching you all those things, depending on the facilities that are available when you're overseas as to whether or not those things are available or whether you need to pay for them, or getting some information prior to having a bit of a practice. And I have worked with quite a number of couples who have been going through the surrogacy process, and we can spend a couple of hours, before your baby arrives, and we do things like bathing and nappy changing and making up milk formula and all that type of stuff. There's a book downstairs if you're interested in that. Infant sleep environment, not only the infant sleep cycles, babies have, their cycles are in some ways similar to ours, but also quite different. And without going into a lot of detail about that, babies do actually, they have a light sleep cycle just like we do, and the potential for them to wake up will depend greatly on their physical environment, how they're feeling in terms of their senses. If they're too hot, too cold, if there's a sudden noise, if they're hungry, they're the sorts of things that will wake them up. But hopefully if their environment is fairly constant, then they'll sleep through until they're actually ready to wake up for their next feed. There's the SIDS guidelines. I'm sure all of you know about SIDS and Red Nose Day, which is coming up in June. There are guidelines that are recommended for safe sleep, and I know that with twins and triplets it can be a bit harder to accommodate all those things sometimes, but we still strongly recommend that you do follow them. There are no guarantees that following the guidelines will prevent SIDS, but there is a definite decrease in risk if those guidelines are followed. Infant feeding, what do you feed your baby? And to a large extent that will have an impact on your relationship with the surrogate to start with, whether they're able to offer breast milk, whether they're able to express, or whether that you're going to put your baby on formula to start with, and then the choosing of which particular formula you'd like to have. Making up formula, how you do it, how you store it, how you keep it, and with that also travelling home, which I'll come to shortly. The best positions for feeding a baby to decrease the amount of wind that they take on board, the best type of bottles to use. All of this I'd love to be able to, expand on for you, and as I said, it's a huge topic. What their normal feeding patterns are, and also remembering that babies go through growth spurts as well. And so just when you're thinking that you've got them all sorted and you know what's going on, 4 to 6 weeks I'll have a growth spurt and stuff all that up. And then again, around about 8 weeks I'll do it again. So they're always going to surprise you in good ways and challenging ways. And of course, crying. And crying and settling is one of the things that a lot of parents fear most, how we're going to settle them and why are they crying. But again, if we go back to the fact that their world is all about their sensory capacity, and so if we can understand that for the main reasons they cry, I'm not sure whether they put them down there, the main reasons baby cry are generally due to hunger, illness, or pain. They're too hot or too cold, or they're wet or dirty, or they're tired. And the sixth one, which is probably just as important, if not more so than all the others, is love and safety. And people tend to forget that one over and above all the other practical stuff. And you have to remember that for a baby, if they've been contained in a very small environment for 8 to 9 months, and then they're born and they're out there, for them to feel safe, they have to feel contained again. And to be contained, they need to be wrapped or held. And your baby's physical and psychological development is just as important with being held and feeling safe as it is as being fed. The two of them correlate very closely together. So it's really important that you do give your child, love and security. And people will say to you, oh, don't pick up the baby and spoil them. Baby doesn't have the mental capacity to understand spoiling. When they're about 8 weeks of age, they do tend to associate different behaviours. That's certainly not in the first two months. And how many of you wouldn't just, if you love a child, wouldn't go and pick them up and cuddle them anyway? I mean, we do it all the time. We do it with people we love. We do it with people, we like to see. So why wouldn't we do it with your child? Babies become stressed far more quickly than we do, and so as a result of that, their bodily systems can start to alter much more quickly than we do. We can run on adrenaline for quite a long time before we actually start to, not sleep well and feed well and making bad decisions, that type of stuff. But for babies, it happens in a very short space of time. Some quick suggestions for settling. Again, looking at those 6 basic reasons. Obviously feeding them, changing them, altering the amount of clothing they have. But babies love movement. So being held, being put in a sling, going for a walk in a pram. And if you have any if you have any pets, dogs in particular, and you are expecting a baby, once you've got the pram, okay, you can put a doll in it, or you can just hide the pram so nobody can see what's inside. But don't start taking the dog for a walk in the pram. With the pram, not with the pram. Small hooks. So that the dog can actually get used to walking beside the pram, and that's that's double positive, because you can get out for a walk yourself and can take the dog at the same time. Okay, moving on. The most important things really about becoming a new parent is to relax and enjoy it. It's one of the most amazing experiences you can go through. It's a time of challenge and joy. But if you have a pretty, if you've got a fairly sound understanding of what a baby is, we like to do all the practical things like the nappy changing, the bathing and all that kind of stuff. But if you can actually understand what a baby is, how they work, then our response to them is far better. And the only example I can give is I actually train seeing eye dogs as well. And, you think the dog's actually thinking what you think, but they're not. We like to think they are. So we treat them like a human, an adult human, and we often treat babies the same way. We have to remember that babies are a unique and they're quite different, and they grow and change and challenges all the way through. And if we can, you know, listen to, watch and be part of our baby's growth, then we often as a parent develop, and that relationship is just so much better. So relax, take the time, enjoy this amazing experience. And I put this up just because I thought it was cute. Twinkle, twinkle, little star, do you know how loved you are?